When a joint starts failing, the pain quickly narrows your daily life. A simple weekend hike becomes a careful calculation of physical limits. And when that physical pain crosses a certain threshold, you need relief immediately. That desperation puts you in an incredibly vulnerable position as a patient. You have to step into a medical market, especially in a massive hub like Bangalore, that is flooded with high-volume corporate hospitals, all competing intensely for foot traffic. This creates a very specific anxiety. You start wondering if the doctor is recommending a massive, expensive joint surgery because your body actually needs it, or because it's the most profitable procedure for the clinic. That distrust causes people to freeze. They delay making an appointment, try to ignore the pain, and let the underlying tissue deterioration get much worse over time. So the first hurdle in orthopedic care isn't actually treating the physical joint. It is finding a medical provider whose financial motives do not override your long-term mobility. This brings us to Arka Anugraha Hospital in JP Nagar. Their entire orthopedic pitch is built as a direct response to that anxiety, explicitly prioritizing ethical treatment and a strict policy against unnecessary surgeries. This comparison table breaks down exactly what that means. On the left, you have the standard corporate approach, which leans heavily toward aggressive intervention and fast patient turnover. On the right is Arka's philosophy, built around conservative treatment and phased rehabilitation. Looking closer at the Arka side, you can see how ethical treatment changes the math for a patient. It extends the required time to relief, but it maximizes long-term joint preservation. Giving transparent medical advice often means telling a patient they don't get to go under the knife today to fix the problem instantly. That presents you with a serious choice. Are you willing to commit to a slower, methodical recovery, or does your specific level of tissue damage actually demand immediate surgical intervention? Walking through Arka's doors means actively trading the allure of a quick surgical fix for a patient-first recovery process that demands your patience. We can see this methodical approach in their 4-step conservative pathway flowchart. Healing here isn't a single event, it's a heavily structured system. Phase 1 is assessment. They evaluate your range of motion and dig into your medical history. As the chart shows, the required input here is your time and patience. From there, you move into diagnosis. This is where they deploy advanced imaging to pinpoint the exact structural failure, guaranteeing an outcome based on accurate root cause identification. But look at the trade-off flag on this node. That intense diagnostic thoroughness means delaying your immediate relief, and it requires paying upfront for advanced X-rays and imaging. The clinic will often hold off on prescribing heavy painkillers during this window because masking the symptoms can obscure the data needed for an accurate structural map. Achieving highly accurate diagnostics shields you from the disaster of an incorrect treatment, but it does mean you have to endure the discomfort a little bit longer while the data is collected. This brings us to node 3 on the flowchart, the treatment plan. This emphasis marker highlights Arka's strict default to medication and non-surgical options. Bypassing the operating room has profound physical benefits. You avoid immense bodily trauma and completely sidestep severe hospital-acquired infection risks. Skipping a major joint or spine operation also keeps hundreds of thousands of rupees in your bank account that would otherwise go toward surgical bays and post-op care. However, you pay for that financial and physical safety with your calendar. Natural tissue repair is stubborn. It is a slow, gradual climb, and it rarely provides that overnight sensation of simply waking up and feeling completely fixed. Arka's ethical philosophy protects your bodily autonomy and your finances, but it demands immense mental resilience to see a lengthy, natural healing process to the very end. That resilience brings us to the final node on the flowchart, recovery. The stark label here is clear. This phase requires high patient compliance, heavily focused on dedicated physiotherapy support. You cannot be a passive passenger once you reach this stage. Rebuilding bone density and joint mobility requires you to sweat, stretch, and actively do the work. Now, there is a critical caveat to all this. Arka Anugraha does possess very modern NABH-style operation theaters. They keep those surgical facilities strictly for when they are genuinely needed, severe accident trauma, massive fractures, or cases where the conservative path has conclusively failed. Having access to that advanced infrastructure means you are paying for a premium safety net. This is a comprehensive care facility, not a budget-tier clinic. They provide state-of-the-art surgical bays as a necessary emergency backup, rather than treating them as the default starting line for every person who walks in with joint pain. So how do you know if you actually belong here? This 3-tier scorecard maps Arka's offerings directly against the medical realities of different demographics. The chronic sufferer lands squarely in the ideal match tier. If you have long-term back or neck pain and need a trustworthy second opinion before succumbing to a pushed surgery, this is exactly what you are looking for. An athlete dealing with ligament or muscle injuries joins them in that top tier. Sports medicine requires maximizing natural joint preservation, which perfectly aligns with Arka's conservative priority. The caretaker managing a parent's age-related bone density fits nicely into the acceptable match category. The hospital's compassionate, low-intervention approach is highly reassuring for elderly patients. Arka's methodology works for patients and families who view the human body as a long-term asset to be maintained, rather than an inconvenience to be quickly operated on. Conversely, the misalignment tier is clear. If you are looking for absolute budget tier care or a pill that offers an instant, effortless fix, you will be frustrated here. Furthermore, if you refuse to participate in the required ongoing physical therapy, you will fail Arka's recovery methodology entirely. It is also worth noting that highly complex quaternary care, like specialized orthopedic oncology, sits outside their primary listed treatments and will require a different institution. The final decision comes down to a clear trade-off. You have to balance the intense desire for immediate pain relief against the physical effort required for ethical, sustainable rehabilitation. Your choice of hospital ultimately dictates the terms of your recovery, deciding whether your injury is treated as a quick financial transaction or as a long-term collaborative healing project.